When I escorted my cousin to the hospital, she claimed she was going for a medical checkup. I ignorantly followed her. The nurse explained that during our ovulation, they would run some tests and would, during ovulation, and they'll give us some injections. When we're ovulating, we'll now come to the hospital. They'll admit us. They will now bring out all the eggs, all the fertilized eggs, and then pick out like 2 or 3 to donate to a family that don't have children of their own. If they give me 500,000, will I join my cousin to donate my eggs for this family?
This is Unspoken. My name is Chichi Umesaka. This is that show where we get to talk about those conversations that we literally do hush hush. This is that show where we expose certain trends that are overlooked or sometimes clearly ignored because maybe we don't understand what it entails, or we don't even want to dive into asking lots of questions. But on this show, we bring real life issues, real life situations, and talk about them in a very constructive way. We're not here to judge, but to make, bring cases and constructively educate us and also maybe inspire us to do the right things. My name is Chichi, and on today's show, I'm too excited. I think you can even see it from my body language. I'm very excited with the guest I have today, because the conversations we are going to be having on this table are things that I particularly have been very scared. I'm worried, but sometimes you don't even know who to ask. You don't know where to turn to make sure that, you're asking the right questions. Today I have the right person who is going to help me handle some of these conversations. I said conversations, it's not one. I have a seasoned medical professional. I want to, do like a drum roll, but it's not working. I really want to because he's wearing too many caps. He's like a legend in the medical field. Okay, we'll go on a short break. Let me try and drink my tea small. Then when we come back, I will go right to introducing my guest for this episode. Don't touch that down. We'll be right back.
A child is born out of IVF and he gets to know, does he have a right to locate his original parents and siblings?
So you're against terminating pregnancy?
No, I don't do it. I don't make any judgments.
So why will a doctor say that to?
Who told you he's a doctor?
Welcome back. This is still Unspoken, and my name is Chichi Umesaka. If you're just joining, this is that show where you will get to learn, relearn, and unlearn. Like I said, I have a seasoned professional, a legend in the medical field. I have with me Professor Ishaya Pam. He is a specialist in obstetrics and gynecology. Did I get it?
Yes.
If not, you will send me out of. You will tell me to go back to school. And then he was the former chief medical director at Jos University Teaching Hospital between 2005 to 2013, and currently the cap he's wearing now amidst plenty caps. Of course, he's wearing physical cap, but the plenty caps he's wearing, he's currently the honorary special advisor to the Plateau State Governor on Health Matters. I mean, this man is a living legend in the medical field, and there is no other person to have some of these conversations that we're going to be, having today. There's no other person than you, sir. Thank you so much, Professor Ishaya, for being on the show.
Thank you for inviting me. I'm
Thank
very
you.
happy to.
And I'm blessed and I'm very honored that you are, obliging us to help us, throw a bit of light. And I tell you, this is more like we're creating awareness. And I believe this conversation is going to open a lot of, other conversations that might even lead to a bit of, maybe not a bit, revolution, and I'm hoping that's what this conversation will lead to. The conversations we're going to be having on this should be able to shake the tables. Thank you so much again for being here, sir.
Thank you very much, Chichi.
So I'm going to sound like the layman because I want everybody to, be carried along. So you can now come from the, use the terminologies and, educate us, but also keep it a bit so that even the market woman will be able to understand. So I want us to talk about surrogacy. I want us to talk about IVF, and there are a couple of other things. But let me say that, surrogacy is not a new trend. And like I said earlier, this show is not for us to judge. It's not for us to start pointing fingers or saying, so it has nothing to do with that. But we want to educate, so that whatever people are doing, whatever decisions or, even the professionals, so whatever they are doing, they will also be able to understand that they owe it to the people to educate them some more. So I would want us to talk about surrogacy. It's an international trend. But from the look of things, from the recent things happening in our country, in Nigeria, because this is where I want to focus, I feel like there are no proper structures, regulating this surrogacy, issue, and also IVF. So I would want you, please, maybe first of all, just briefly just tell us what is surrogacy, what is IVF. I know both of them are not together, so just take your time and just educate us. What do they mean?
Well, thank you very much. Just to add to my introduction.
Thank you.
I was trained in infertility and management of infertility at the Center for Reproductive Medicine at the University of Warwick, and also in India at the Apollo Hospital. I did some training there. So that's where I became interested in assisted reproductive techniques. So what we were talking about, the umbrella name for all these techniques or technologies is, we call it artificial reproductive technology. Assisted reproductive technologies. ART,
because I saw that online. Yeah.
Yes.
So assisted reproductive technology.
Okay. So you have what you call we have intrauterine insemination. Those are the simpler ones, where the sperm is taken and put right into the uterus to enhance conception. You have also the intracytoplasmic injection, where in actual fact the sperm is put right into the egg and the conception takes place.
It's injected.
Yes, in a test tube,
okay,
or in a dish.
And before they now put it into the womb, back into the womb.
And then you have the in vitro fertilization, the popular one, IVF, where the woman's egg is taken from her and the sperm is taken from the man. It's put in a dish and fertilization takes place, division takes place, and then at a certain stage, when it's viable, the embryo is put back into the baby.
Into the womb,
yes.
Okay.
And then, of course, where it is not possible at all for the woman to carry pregnancy, perhaps some that have congenital anomalies or problem with the womb, then you now have to go to another person, another female, who will now agree to carry that pregnancy on behalf of the patient. So in a nutshell, those are some of the techniques and technologies that are available now, even in the country, to deal with the issue of fertility, which is a very, very distressing challenge for couples, because we all know how much value we put on children in
this part of the world.
In this part of the world, culturally and in many ways. So it's something that has come to stay. And so right now in Nigeria, we have over 50 fertility centers officially, and more than half are in Lagos and in other urban areas. But the practices are spreading all over the country. And we have quite a large number of women who need these services because we have issues of infection, tubal damage, and then invariably at the end, ovarian issues, because
Like
many
fibroid
women,
and all that.
yeah, that's the uterine factor, the womb. Fibroids could be a cause or an effect of infertility. And then, of course, these women usually don't seek help until they are much older,
Okay.
because it's an expensive form of treatment. And then they may try other means before, maybe natural. They will go, they say, homeopathic means, try some fruits, and then spiritual, before they eventually come to hospital. They're in their 40s, and the ovaries are not able to produce the eggs. So you end up having egg donation. So these are some of the issues surrounding infertility.
Okay. So you talked about, this is gradually spreading. We have over 50
IVF,
IVF
ART
centers. Okay, or ART, let's let ART centers, if you don't forget it, assisted reproductive
Yes.
technology.
Yes.
I'm a smart student.
Yes, that's right. You got it right.
Thank you, sir. Okay, so are there regulatory bodies? Because we are going to go right into, but I want to even start from who are giving this, like do people need, like you mentioned, and I'm glad you were able to like set this the record straight. You're not just just a professor of gynae, but you got special trainings,
Yes.
from some of these universities, and that you mentioned abroad. So you specialize in fertility, not just in because when we hear gynecology, people think, oh, you could just give birth.
General.
Yeah, general, you give birth. So I like that you mentioned this. So who, and we are focusing in here in Nigeria now. These doctors that are now opening centers, fertility centers, because I see adverts on social media where they are saying, oh, come to my center. Do we have people that go to make sure that these people are licensed, they have the right training, they have the right equipment to be able to operate these centers?
Thank you very much. There is a big challenge when it comes to regulation, even guidelines to practice, even the law. There's no law in place right now. There was a bill that was introduced in the National Assembly sometime in 2016, but it's still there. And,
2016?
Yes.
And this is 2025?
Almost 10 years now.
Wow.
But some states have gone ahead to pass their own laws.
And domesticate it.
Like Lagos State has its own act now, or edict, to guide the and regulate assisted reproduction. And so, it needs to be regulated. Right now, there's no regulation, but there's an association of fertility and reproductive health where all the practitioners are registered.
Okay.
And they have set up guidelines to regulate the practice. But you see, guidelines can be followed, and they may not be followed. Yeah. But ethically speaking, they are guidelines. And we also have regulation by the Medical and Dental Council of Nigeria, where there are practices that are outside recognized international best practices. They can be, complaints can be taken there. And so the Federal Ministry of Health regulates practice, medical practice in tertiary institutions, while the state governments regulate medical practice in general hospitals down to the primary healthcare centers. So because health is on what we call the concurrent list. So that is the structure.
Okay.
But without these acts, it's difficult to sanction the practice in some circumstances, except, of course, human rights abuses. Some of the practices might fall under human rights abuse. Some can be run foul of the Child Rights Act, where you have children getting involved, 18 years
Exactly.
and below.
That's where I'm
so,
coming. Yeah.
so there is this possibility of regulating the practice, even despite the fact that the laws are not in place specifically. So we have to train our law enforcement agents and the entire chain, the judges, the judiciary, and all the bodies to recognize that there's a problem. It's just now that people are beginning to see some of the problems. As you said, it's unspoken.
Yeah.
Because the issue of fertility is like a stigma.
Exactly.
Most women don't want people to know that they're struggling with fertility.
Exactly.
Because the stigma is, she's been fooling around.
True.
So she has damaged her womb.
True.
And so on. So it is all hidden under the table. They go to a doctor and there's confidentiality and so on. So we need to open up and remove that stigma. It's like any other medical challenge, and then it can be sorted out in the open. But now there's a lot of clandestine practice.
Yeah.
So what are some of the challenges? Young girls are lured into egg donation. Young boys are lured into sperm donation.
Donations. Oh my God.
They're lured into surrogacy. And some go about as commercial donors now. It has become a business when it shouldn't be. It's unethical.
I want to, because I want you to explain that commercial.
It has been commercialized. You have agents, you have facilitators, you have a whole value chain dealing with issues of fertility, just like you have now with transplants.
Exactly.
So that can only happen when there is no system in place. It should not be a business. It should be altruistic. And it's also, if you must give any money, maybe compensation for discomfort here and there, but not to be selling body fluids and tissues and so on. It's unethical. And that unethical aspect should be taken care of by the law. So we don't exploit these children, and then in future they run into issues and there is nowhere to run to.
Prof, let me take you back a bit. You mentioned that the law, has not even crossed anywhere since 2016. Yes. And for me, the question is, are laws set to, because, you also talked about training the law enforcement to know, so the question is, should the regulation be, forced when there's a problem? So that's like, we're not doing preventive. It's more like that we are trying to, maybe when there's a problem, we are now running to arrest or do this or do that. Shouldn't the law be, this is what you're supposed to do? Don't even involve children, don't involve underage, don't involve, shouldn't be.
Absolutely, Chichi. For example, what should be the age at which a person should be able to legally donate sperm and eggs, for example?
Exactly.
What should be the age? We have to set it.
Exactly.
Internationally, 21, for example.
Okay.
And then the number of times has to also be regulated. You can't go on and on donating your tissues and so on, because there is an ethical issue. If one person gives birth to through IVF, one man is able to have 100 children, and then one girl is able to have her eggs in 100 babies.
Oh my God.
Nature did not anticipate that. So there is a potential chance of what we call an incestuous.
Exactly. The same children from the same, just being multiplied different places.
So a girl in Abuja that has so many eggs taken away from her and fertilized, in future these children could. There's a chance that they can meet and become partners or marriage, no, that's incest.
Absolutely.
And it has an effect on society.
Absolutely.
The children of an incestuous marriage usually tend to have a higher risk for congenital malformations.
Really?
Yes. Because a defective gene here and a defective gene there can come together and produce an abnormality. So the risk is there.
Oh my God. So we're not
miscarriages, apart from miscarriages and other difficulties in reproduction.
Just because they have a...
Yes, I mean, these are talking about first brother and sister, half. So incest is an issue.
My God.
And so the whole system needs to be sorted out. We have to have a national register. We have to have registers in every clinic. We must know where the eggs are coming from. We want to know where the babies are going to. And then we can monitor. And then the rights of these children that are born through this technique, they didn't ask for it.
Exactly.
So if a child is born out of IVF and he gets to know, does he have a right to locate his original parents and siblings? And vice versa. Having donated maybe 20 years ago, a man now says, oh, look, I want to know who my children, where they are. Does he have a right? So a register and the law to guide confidentiality. So a person should know, oh, I came from this IVF center. And he can go back 20 years later and say, I want to know. Then they say, okay, fine, we will ask the donor if he wants to meet with you or she.
Hey, this is deeper than...
There's a lot to it.
For
example, somebody might develop kidney problem and he needs a transplant.
And it has to be someone...
It has to be somebody close to him that will match. Then he decides he wants to find out where the children are. Does he have a right to do so? And now that DNA is becoming commoner.
Exactly.
A child does a DNA and then he's told Ancestry, for example, that he has 10 cousins in the neighborhood.
Hey.
So there are ethical issues. We need to guard against this. We may not see it now, but it will come.
Exactly. So I watched a documentary on Netflix. In fact, that was where this, whole thing started spurring. Like, I wanted to dive more into this conversation. And they discovered that, so I think they called it 1,000 kids or something like that. Which country did this happen? They discovered that a medical doctor was the men donor.
Yeah.
These women, they will go to shopping mall. These kids would now say, you look like me. This one, you look like me. Before they knew it, over 1,000 of them, when they went to do DNA, they discovered they were coming from one man. He was picked up and arrested. But for me, just like you're saying, if we don't curb this or try to manage it, it will get out of hand.
Mm-hmm.
Okay, Prof, we'll go on a short break. There are too many questions, and I want us to use real life, like you've mentioned some cases. I would want us to use certain cases because I think people remember stories more than when you are giving points and all that. So we'll go on a short break. When we come back, let's use real life situations. I mean, I didn't even know that if siblings end up meeting themselves to marry, there's likelihood of
higher risk
of complications.
For sure.
I'm hearing that for the first time.
Pregnancy, yes.
I don't think you want to change this now because there is so much you can learn from this show. Like I said, this is that show where you would learn, relearn, and unlearn certain things. Don't touch that. We'll be right back.
I'm sharing this story from a personal experience to enlighten and also create awareness to the young girls out there who might fall victim of these people. I almost fell victim to agents who are in the medical field that recruits young girls to donate their eggs. That's to sell their eggs for some amount of money. So this story happened to me personally. I escorted my cousin to the hospital. She claimed she was going for a medical checkup. I ignorantly followed her. When we got to the hospital, the nurse now went into explaining to us what we were there for, including me. I didn't know what I was there for, but obviously my cousin knew why she was there. The nurse explained that during our ovulation, they would run some tests and would, during ovulation, and they'll give us some injections. When we're ovulating, we'll now come to the hospital. They'll admit us. They will now bring out all the eggs, all the fertilized eggs, and then pick out like 2 or 3 to donate to a family that don't have children of their own. I didn't know they had a prior agreement that they were going to give her some amount of money. They now asked if I have given birth before. I said no. If they give me 500,000, will I join my cousin to donate my eggs for this family? I said no. They now said, why? They said, did not try to convince me to donate my eggs, because she kept explaining to me that the family that wants this donation, they are desperate. She started pleading with me, saying that the woman is light-skinned and should really want somebody who is light-skinned like me. I told her I wasn't interested. And she was it became like she was forcing me. She tried to convince, she added 100,000 naira to the 500,000. I still said I wasn't interested. Then when she now said I should excuse her for a minute. When she went out, I now got up from the seat. I opened the door slightly. I checked around. I didn't see her or my cousin. That was how I escaped that place. I left the hospital quietly. I didn't even bother looking for my cousin because I knew she was in on it. They had probably given her money. And that was how I escaped that place. When my cousin came back later on that day, she said they had given her the injections and she was going to go ahead with the thing. I tried to convince her. I tried to talk her out of it, but she refused. She was just all about the money. I asked her how much they paid her. She said they paid her 250,000 naira. And after the procedure, they would pay her the balance. Few days later, she went back to the hospital. I think they did the procedure. She came back home in serious pains. She was bleeding, but from the explanation, they removed some eggs from her. I don't know how many they took out from her, but so I want to encourage every young girl watching this. Please and please don't fall victim to this. If you are in a situation like this, always speak out.
Welcome back. This is still Unspoken, and my name is Chichi Omesaka, and I have with me Professor Ishaya Pam, who has been, literally he has been teaching me a lot of things I didn't know. And I hope you're also learning a lot. And I think I would want people to just jot down where you're going to see our social media handles, scrolling through. Feel free to ask questions, because I would want this show, like I said, this is going to be like a table shaker. I want this conversation to be able to raise more conversations and let people start talking. And, hopefully there will be revolution. Like we need to maybe get the House of Assembly to pass this bill or to even revisit it and see if there are things people need to add again. Because 2016, with what was happening in 2016, and this is 2025, there should be too many things to be added on that. Mm-hmm. So I think this conversation should be able to start more conversations. Prof, thank you for still being here. Now, I would want us to use, real life scenarios. You mentioned earlier where underage girls and even boys, I didn't even know that, boys could, see this as a commercial means of, we learned about the transplant. A lot of people didn't know that it had gone bad until, one of our leaders tried to do something and, they were caught. Mm-hmm. And that's where this is leading. Recently, a lady, cried out on social media saying she found out that her cousin went and did, gave eggs. And people were even laughing and asking, how do you collect eggs? People didn't even understand that this is actually a deeper case. And she was upset that this girl collected stipend like peanuts to give out her eggs. Just like people are making jest of this and thinking it's just like, oh, it's just eggs. Please, can you explain what does it entail? When you are talking eggs, is it just they go and they just
Okay.
do like this, poke you, and then egg comes out.
Okay.
What are the procedure? Help me just.
Well, the procedure is this usually a cycle, a menstrual cycle and a cycle, ovulatory cycle. Naturally, a woman might just produce 1 or 2 eggs or 3. So for IVF, the success rate is very low, usually 20%, 30%. So you want to get as many eggs as possible. So what happens is that during the cycle, drugs are given early in the cycle, straight after menstruation, to make the woman super ovulate, so that there are more eggs being developed.
The word there is super ovulate, not
Yes.
ovulate, super.
So you're looking at, say, 8 eggs, 10 eggs.
For
So
someone that is supposed to do 1.
2 or 3 maximum, yes. So you give drugs, and then when the eggs are ripe, you still give another drug to trigger ovulation. So, and then when she ovulates, you are monitoring, tracking through ultrasound scans and blood tests. You know the right time to go and collect those eggs. She's taken to theater, given some mild anesthesia.
It's surgical?
Yes. Procedure, it doesn't involve cutting. But through the vagina, you put a probe, you put a very small tube or instrument that you pass through the vagina to the ovary, which is enlarged, and you're watching through ultrasound, and you suck out the eggs. So
The eggs.
Yeah, the eggs, the ripe eggs, you suck them out straight into a test tube. She's out of anesthesia. The procedure shouldn't take too long, maximum 30 minutes.
I mean, that's
and
the light
everything.
they sell to them. Oh, this is not going to take just
And
30
she
minutes.
goes home same day. So
the-
very rarely are there complications.
effects.
In the effect. Yeah. So usually it's pain that they feel, and chances of bleeding are minimum, or infection if it's done properly. So the eggs are collected and then transferred immediately into medium where they can be stored and developed. And then at the same time, the sperm will now be put into where the eggs are, and then
Okay, Prof. I mean, I want to
take it from
stick,
there.
First, let me even ask, do they, like the people that donate this? Because I remember a few years ago, I thought of, becoming a surrogate mother for a friend of mine. They are struggling. And I felt, I have 4 children. I'm still very fertile, still young. Maybe I will just do this. It's not about the money. It's just to support this family. And then I went and had a conversation with a doctor friend, with my personal doctor. And by the time he explained what you explained, number one, I remember when I had a miscarriage. There was a time I had a miscarriage and they needed to do evacuation. And it sounded like what?
Procedure.
It's simple. And that's why when you were talking, the trauma, I'm trying to bounce it up, because that experience, I don't wish it on my enemy. Yes, I was numbed, but the kind of pain you feel is a different kind of pain that almost, kind of messes up with your, and my pain threshold is just so small, very low. When I heard that, I'm like, I'm done. I'm not doing. Thankfully, I never mentioned it to my friends so that they won't start mounting pressure. But I wanted to understand what it entails. My question is, the doctors, do they, these donors or these surrogates, whatever, or the people that want to donate their egg, do they sit them down to explain this? I mean, you made it look like it's just very simple. You do it, 30 minutes, you're out, you go home the same day and all that. And they say, okay, for how much? Okay, give me the money. But there are complications. Maybe not now, but in the future. So the doctors, do you people sit down with, not the people that are excited to have this done for them, but this other person who is going to be doing this, do you people also sit them down to give them guide and, give them lectures on how much this is huge sacrifice you're making? Do you people do that?
Well, that is the ideal, and that's the protocol. You're supposed to counsel the donor about the procedure, about everything about it, even before you start administering the drugs, the medication.
Sadly.
And the possible side effects of the medication and the possible short-term or long-term complications. And then they consent. They sign a consent. And then the procedure continues. So they need to be told, like any other thing, graphically, what it entails, and even for their future mental health, because you're going to give out your eggs. That egg will turn to a baby, hopefully, and you will not see that baby
Ever again.
Except, of course, you sign the consent includes the possibilities. So did they even know what they're signing? Do they know the content? So it depends on, you see, we have left it to the practitioners to decide what to do. Everything should be standardized and it should be enforced so that we know. So the issue of regulation is important. People visit from time to time, make sure the process is being followed. You should have an agency or a commission that will do the monitoring and evaluation and get feedback.
Because for me, that's where it's very important. They should monitor, they should evaluate. We shouldn't wait for when there is problem. Yes. When things go wrong, we now start trying to, it was the word, they say prevention is better than cure. So it's curative now that we are looking. We should be doing
punishment.
Punishment, exactly.
We don't.
Exactly.
We should avoid such situations.
Exactly.
So we should have a system in place whereby everyone is committed to a safe practice and they do what is right, and we inspect and ensure they have the right equipment.
Exactly.
And everything that is required to prevent any negative outcome.
Prof, let me go back to this because I really want whoever is considering doing this for, this is not to spoil the, excitement for the families that would need help. Like I said, we are not here to judge. If for me to even consider doing it for a friend means that I feel like every family should, be opportune to have children and all that, but it shouldn't be done at the expense of someone else's, safety or whatever. So I still want to take you back to these girls that do this. Do you think that most of them do it out of motivation, financial motivation, or let me use your word, commercial motivation? Off air, you were telling me that there's a girl who was doing it like for the fourth time, and this person is currently. So I would want to just tell that story, and do they do it out of commercial, purposes? I need this money, or I just want to do this because I feel like I need to help this family.
Yeah, so there's a bit of each. There are families that have this fertility issue, and within the family, they probably would find somebody who might want to help out. And that's the type that is of the highest ideal, is altruistic. It has nothing to do with money. It's just that a sister or a brother has an issue, and quietly you bring a donor, and they carry on like that within the family. That happens and is the best possible scenario. But then there are scenarios where the couple, for reasons that, for many reasons, may not want to use their family members or do not have or cannot get them interested. They go outside the family system, after our extended families, and they look for a donor that's not related to. You see, one thing about using family members is the future. They can come back to claim that child and then start legal battle, even if you've signed everything.
Yeah, we've seen that in adoption issues. Yeah.
So the nearer the donor is to you, the higher the chances of
the risk
risk happening, rather than an anonymous donor. And the two families or the two persons are separated from each other. They don't know each other. People travel around the world to go and do surrogacy to prevent this issue of
tracing
and coming back to request for the baby and so on. So I know right now a girl who is into her 4th pregnancy. She had a first child by herself, teenage pregnancy,
And
then
gave
she's
out.
had, yes. Then no, that one is at home. Then
Okay.
she's had one surrogacy. She had twins. Then she had another surrogacy pregnancy, and now the 3rd one. But as
In
things
total,
happen,
that's 4 children now.
complications have set in, and she's in hospital. So it could be life-threatening, because you are using drugs, you are using all sorts of interventions and so on.
And you mentioned this girl
And
is
this
in her
girl,
20s.
by the way, all the deliveries have been by the surrogate, the pregnancies by cesarean section.
Wow.
So, and if she's in her 20s, imagine what might happen in future.
Exactly.
And the father didn't know, so it led to the breakdown of the family.
So the mother knew?
The mother, of course, she found out later, but, trying to manage the situation, and it didn't work. And then what the hospitals do is they move the patient out of their locality, their community, and they probably rent a place for them far away. And so they can go through the process of pregnancy without...
That's like baby factory.
That's it. That's the word for it. Baby factory is just that the conception is natural.
Yes.
But it's almost the same thing.
It's
This
almost
one
the
is
same.
artificial.
Exactly.
So you keep the woman somewhere, she gets a monthly allowance, she's fed, and then after the procedure, she's paid off. And as soon as the baby is delivered, she doesn't see it. So there's no attachment, and the other lady is at the other end to collect the baby. So,
oh my God.
So there are some countries that have outlawed surrogacy. And so their citizens move around the world.
Oh, there are countries that don't allow it.
Yes, there are countries. So
what kind of? Can you mention some of the countries?
Yeah, some of them, the Islamic countries and so on.
Okay.
So you find people moving all around the world
and coming to Nigeria because
Nigeria is becoming a destination for.
Oh my God!
Transplant.
There's no regulation. Nobody's.
So Africa is a place to go to, and it's something we need to regulate.
Wow.
And there's a lot of money involved in the entire value chain. So we need to decommercialize it, as it were, and take it back and make it ethical. This is a problem, a challenge that people have. They should not be exploited. You shouldn't exploit them.
Okay, Prof, sorry. So you mentioned value chain. I need to end the show, but as we are talking, there are questions that I'm bringing out. So, value chain, there is the medical people, then the people who find the donors and get the
agents.
The agents. What do they do? They are like the ones that
find.
They
are in some community. So they go to these girls, they notice the vulnerable girls who have financial problems, just like you would a drug dealer. Somebody who needs money, say, hey, do you know you can make #1 million?
I mean, this is another form of trafficking. Yes, when we say trafficking, it's like moving.
In fact, it's human trafficking, but you're using the embryos. So that's how we should view it. I mean, you see a young girl selling things by the roadside, suffering, can't go back to school. And you give her this option and tell her it's not a big deal. And you make, at the end of the day, you probably have made a couple of millions.
How much do they give these girls?
It depends.
I know you don't want to, but let me even say, the ones I heard, they are not up to $1 million.
They will get something every month. And at the end of the procedure, they will still get something.
But is it worth it for
you are looking at it from your perspective. #1 million is a lot of money to some people, but they think, and you are talking about young girls, they immediately think #1 million is something. Just kidneys are sold for that kind of amount. Then they now realize
is life-threatening, for something that is a decision that is not just like, how it's something outside of your body.
Sure.
This is going to take, because we're talking about hormonal. Yes. They're giving you injections that would upsets everything in your system,
system.
and your body can never remain the same ever again.
Things happen, complications happen, and so we have people who donated decades ago, and they are living in regret now, mental torture, all of that.
And some of them might not have even,
And,
they couldn't have their own children.
Possibly, they don't know. They say, when I was in school, I went and I remember when I was in school and medical school, we had a doctor who was actively soliciting us to go and donate.
Oh, this is
because
not.
They're looking.
This
for
is not
people.
new.
It's not new. You see, they're looking for.
Oh my God!
People of the highest intelligence and quotient. That's what the patients want. Oh, this is coming from a scientist, so they're looking at, this child is going to be brilliant.
Yeah.
So they
wanted doctors.
In fact, there are centers abroad where they go for Nobel Prize winners. So they collect the donors they collect the eggs
from Nobel Prize winner.
Those who are interested, yes, and they give. And
oh my God!
You are told that this is from a Nobel Prize winner,
and the money will be higher.
Shopping,
and the money will be higher.
You are shopping for
for
a child, and people describe what they want. Okay, so they can have the physical characteristics of the donor.
I'm sorry, my mouth is all open. I don't even know.
My husband is 6 feet tall, so I want somebody who is tall, or has blue eyes, or is white, or is black, or So it's possible to even determine the sex and the
futures, the futures and everything
of what you want. So it's like shopping for, and that is where the ethical.
Thank you. That was going to be my next question.
We have reduced childbearing, fertility to a store.
Sadly,
put on the shelf. Is that the new normal? Or there's something wrong with it.
Wow.
So, and science is evolving. In the near future, what science is trying to do now is to have an artificial womb. Wow. So the issue of surrogacy will be thrown away.
Exactly.
So, okay, you guys are talking about surrogacy. Here is a womb. You put the baby, put all the nutrients, put all the gadgets, oxygen, everything. They are working on it.
Wow.
So you come and say you rent a womb. Put my own here. And you come once in a while, you look, hi baby, go back. After 9 months, you come and collect your baby.
Okay, this is
so that's
scary.
Exactly where we're going. So where do you stop? Now, science, the way science is evolving, it's hard for the regulation to keep up. You have stem cells now.
Yes.
You have all sorts.
Wow.
So there's cloning.
I mean, it's just so much. Where do you draw the line?
There's a lot of regulation required.
And Nigeria is not even regulating nothing.
Our luck is that all these laws have been done elsewhere. We can learn from them. We can take...
Thank you. Take templates.
In fact, even the one in the National Assembly was virtually identical with the laws in Australia and so on. But just pass it. And let's get on with the job. Because even regulation, you have to monitor, otherwise we're going to run into problems.
Prof, let me just put it to you. So I'm sorry that I'm gonna put it to you like the lawyers would say, because chief medical director, there's no formal as far as I'm concerned. It's like being a once a governor, always a governor. You always answer His Excellency. So for me, as far as I'm concerned, you are chief medical director for life. So I'm now going to put it to you, sir. What are you guys doing? Because this is your field. A lot is going on, and with the way the generation is going, even the younger generation who don't even understand boundaries, control, and all that. What are you people that are the leaders in this profession? What can you people do instead of just sitting back and saying, okay, we're just waiting? I know that maybe you are making effort, but this is also maybe challenging your colleagues to say, we need to just sit up and do something.
Thank you. You see, it's like a saying that the war is not only for generals. We are on the cutting edge. We are the doctors. But there are lots of social issues, religious issues, ethical issues. So it's an entire spectrum
Legal.
of people. Legal. So we all have to sit down on the table. We are seeing it from the medical end. Then the legal end. That's even the easy part. By the time you go to religion, then you will find people who will say, we don't even want
to have this conversation.
any artificial or assisted reproduction. It's against our religion.
But people in
So
their
they will
religion
fight.
are doing it.
It doesn't matter. It's the same thing with contraception till tomorrow. People are fighting contraception. People are fighting
In 21st century.
making it available. People are fighting sexuality education.
Sadly.
You cannot talk about sexuality to an 11 or 12-year-old child that is going through puberty.
Sadly.
So they are just blank. And they get pregnant. They don't even know the process. Some get pregnant by me. They don't even know they're pregnant. So we have a lot of issues that are confounded by religion. Ethics are changing. Somebody says, it's my body. Why would you government get involved with my body?
Wow.
So that we have those issues with termination of pregnancy.
Abortions? Yeah.
Even in this country, a pregnancy
That is at
risk for her,
Yes.
to her life and
Yes.
the baby,
Yes.
you cannot legally do it.
Wow.
For example, you cannot go to a teaching hospital and say, I want this pregnancy terminated. All around the developed world, it's your right.
Because I
Nobody
handled
questions
a case of a
you.
13-year-old carrying twins. They checked her cervix is so
Yes.
has not even developed. I mean, we're talking of 13. She was raped.
Mhm.
And every form of having this conversation, say, this baby, this girl is at risk. The parents were not listening. The church did not even, the community. They literally wanted to kill me for even allowing the doctors to make those suggestions. So I totally understand what you're saying.
So
The question is
it's
still-
all of us. I should ask you, what are you doing, journalists? And I'm happy you are doing this. That's
Yes.
why I was very
Yes.
happy to be here.
Thank you, sir.
We need to create awareness.
Yes.
There needs to be this debate open. If it
Everybody
were your
will come on the
daughter,
table. Yes.
If it were your daughter, what would be your response? There's a lot of hypocrisy.
True.
And it's the poor and the
Absolutely. The
vulnerable that are paying the price. God forbid, I have a child that has that sort of problem. I will go and call a professor and we will sort it out.
Exactly.
But the vulnerable girl in the village has nowhere to go and she will make the wrong choices.
Exactly.
The only thing available to her is a chemist.
Exactly.
So why don't we have a level playing field? Let's protect the weak. Let's protect the weak.
Absolutely. There was a debate also on social media that trended. One of our celebrities, very popular, I don't want to mention names, very popular celebrity, just one day just came out with her baby, that she had a baby. It was a surrogate. Everybody was asking, where, blah, blah, blah. It was later someone tried to do like an investigative kind of thing to realize that it was a vulnerable girl that they coerced, that's what they used, allegedly, to have this baby. So from what you're saying, the poor, the naive, the vulnerables in our communities, in our country are the ones at risk because they need money, they lack information, they don't even know what they're doing. They just tell them, oh, just do this. You will not, the baby will just be taking everybody, you will be fine. You can still have children when you grow up, blah, blah, blah. And they don't even know, they are paid whatever, whether peanut or huge amount. But the people that enjoy or that take advantage of this are the rich, the wealthy, the famous in our communities. When issues happen with these people in the future, so the question is, can this person still support this person that gave you this child that is going to be with you for the rest of your life, that will make you happy for the rest of your life? Do they put these people on support for the rest of their life too?
Of course not. They are used and dumped. Your daughter, my daughter, to make it personal, are not likely to be surrogate mothers.
At all.
They won't be. The women who are surrogates are usually the poor, the vulnerable.
So they pay them off
And by the way, you can even get a woman who has had her children and decides, I can rent my womb out.
Exactly.
Why are you going for the small
Thank
girl?
you.
A woman who has had 3-4 children and says, okay, I can help somebody
I mean, that
else.
was why I considered it, because I have
To
4
me, you see,
children.
that is why we should standardize
Thank you.
and ensure that we reduce the risks. And these children, their lives are disrupted. A young girl goes and is having children. And by the way, they do one, they do twice, they do thrice. So the money is never ever enough.
Thank you. Because if it was enough, once is enough.
They are ignorant. You give them money today, it's gone tomorrow. And then they are left with the health effects.
Scar, exactly.
A young woman who has had 3 cesarean sections, there are risks attached to it.
Absolutely.
She can have future problems as a result of multiple surgeries.
Oh my God.
Assuming that these surgeries are even done properly.
So, Prof, you talked about if there is a register where you've done once or twice, the moment you go, even if you say, okay, you are relocating from this province or this place, this state to another state, the moment there's a proper register, maybe even updated online,
Yes,
where
national
it's just
register.
a national register that is, there's
With
also
biometrics. And
exactly. And someone you show up in another facility, in another entire place, they see your name and they say, no, you can't. That's exactly what you're saying.
Yes, and because doctors are involved, it shouldn't be a problem.
But do you think it's your colleagues that are also enabling this? Because apparently the doctor by right, they are supposed to ask questions. When someone comes, have you done this before? They say yes. How many times have you done it?
They wouldn't tell you the truth.
So are you saying that the doctors are not complacent and not part of our problem?
Sometimes they do these things. You see, this is a very shadowy business under the table. So we're just speculating. I don't think anybody has even been brought to justice because so it's just speculation. It is possible that the doctors that are practicing ethically are deceived by patients. Patients deceive us a lot, and many times it's to their detriment. Have you done this before? No. Have you done that before? No. Then when you now go to theater or something, you see a totally different thing.
Prof, don't you examine these people before they start giving the injection? So
if you ask a woman now and say, have you donated eggs before? And she says no.
Okay, I agree with you, because you said they are not cutting anybody. So it is, okay, so I agree with you. There are
sometimes
to measure.
Yeah, I can tell from experience, for example, a cervix that has had deliveries or has been tampered with in terms of terminations. Sometimes you can tell, but there are sometimes a woman has had 5 times.
I'm literally like, when we go through these experiences, sometimes people don't know that it leaves like a permanent whatever in our
The
heads.
Emotional and mental issues that come up,
yes,
are sometimes even more than the physical. I've had to counsel couples against terminating a pregnancy. Married couples, they say, we've had 4, this is a mistake. And first, one of the questions I tell them, I said, 10 years down the line, would you still think like this if you terminate this pregnancy? Some accept and say, okay. I have couples who have, and today they look at me with so much respect. And that is the one child that has become a star in the family.
Yeah.
And they say, you know what, thank you, we can't thank you enough.
But what if there are also the people...
There are some who walk away and say, doctor, I came here
to
get rid of this thing, and you are preaching to
and
me.
Forever, they are happy they also did not, because maybe they are not able to take care of that baby.
And I know colleagues that terminate pregnancies, and then...
So you're against terminating pregnancies?
No, I don't do it. But I don't make any judgments.
But do you think that sometimes it's also okay for it to happen, maybe due to health reasons or...
You mentioned rape, for example.
Yeah.
A 13-year-old girl. These are serious reasons to terminate. But again, children that have come out of such situations, some of them they've come out and they've become useful members of society. So I don't like to make It's a whole minefield.
True. I've heard people say, oh, they told them, I have a friend that said she went to hospital and the doctor said, you are almost developing fibroids because you are not sexually active. You need to go and start having sex. And my Christian sister was now shopping for man.
Well,
so why will a doctor say that to?
Who told you he's a doctor?
Is it?
How do you know him? Nobody that has gone through medical training. Except he was being sarcastic or something silly, which he shouldn't be doing.
Exactly.
And he was taking seriously. You don't joke over matters like this. Because any trained doctor will not say to you, because you are not sexually active,
Exactly.
you have fibroids. Fibroids are not, sex is not a cure for fibroids. In any case, thankfully, we have Google now and everything. Whatever anybody says to you, go and Google it and find out. Sex and fibroids. Put those two words inside and you will see that the truth will come out.
What about the prostate? Is it also true?
The prostate cancer, yes, there have been talk about sex being, having regular sexual intercourse being protective. But the issue is how much. That has not been sorted out.
A doctor mentioned
some will
on
say
radio.
5, some will say
someone
21.
said 21.
I've seen it went viral.
Do you agree to that?
How did they arrive at it? You see, it's not a matter of me agreeing. But you look at the studies, there have been all sorts of studies.
But can a man even achieve that in 1 month?
Yeah, again, how practical is it?
Thank you.
Because you are saying that a man should have at least 5 sexual, let me say, 5 a week.
A week.
So 5 times 4 gives you 20. He has not even reached the 21. It means he's not probably going to work. It's just 2 days in a week that is out of it. That man will need a lot of supplements and things.
Even when someone takes supplements.
To improve. So really, some of these studies are just large studies and they make inferences, but it's not easy to prove. Because if you say sex is a cure or preventive, what about people who don't have sex? Do they or do they not have cancer of the prostate? So there are many ways you can study it, but it's we're waiting for confirmation.
Okay. Like I said, you do me the honors to come back on this show multiple times. Thank you so much. But before we go, I want to hear your final thoughts on this matter of ART, the assisted reproductive technology. Yes, we welcome innovations, inventions, and all that, but how far should we just even embrace all these things that are just coming? Yes, people need help in terms of having children. How much should we be able to regulate? Should we? So I really want to hear your final thoughts. And maybe if there are things I didn't ask, if you can just also in a few minutes.
We didn't even go into some areas. Like now, you have multiple births. You find people having quadruplets, quintuplets. There's no regulation. You fertilize 4, 5 eggs. They all become embryos. You now implant all of them. And then the woman has quadruplets. It has an impact on society, the population, and so on. Some countries have regulated, you like in the UK now, it's very clear you cannot transfer more than 1 embryo, even if you have 4. But here, the guideline is maybe 2, but people are still, practitioners are still putting in 4. You see 4, carrying 4. How does a woman cope with that number? And then the risk to her life during the course of that pregnancy, and the very high chance that she will have a preterm delivery. Do we have the resources? So we have to limit a lot of things. But we don't have the law. If somebody implants 4, there's nothing you can do. So like everything else in life, it has its good sides, it has its bad sides. So what we want to do is take the good and then prevent the bad, or regulate it to a point where,
because we might not prevent it, but we can curb it, we can regulate it.
So the technologies are good. We've had IVF since 1978.
Really?
Babies have been born. Yes, the first baby was born in 1978 in the UK. Another one was born in India, same year. But so it's safe. The first girl has had her own children, and nothing untoward has happened. So it's just simply avoiding a barrier, a block. The tubes are blocked, for example. The ovaries are not functioning. So you're just circumventing a barrier. So it's more of a mechanical thing.
Yeah. So we're not saying it's bad, but it's just let it be checkmated. Let it
be controlled.
Controlled.
There should be guardrails, and people should be properly educated before they embark on it.
And the vulnerables and the poor, the ignorant. Let me stay with the vulnerable ones, the underage. I think this is also where I am worried. I think, I'm not going to agree that you are trying to, not say that some doctors are also very, that they are complacent and they are also encouraging this.
Suddenly, in every population, in any professional group, you have bad eggs.
Because a doctor should see a younger person and say, you are too young for this.
Yes. But there is no law. So if he says she's 18 and she wants to do it, fine, and her parents have signed. Wow. And she brings someone to sign, this is my dad.
And a doctor cannot say, sorry.
Or the patient says, I brought my sister.
Can't a doctor say, no, I won't do it?
Of course you can.
But
if you choose to do it, there's nothing stopping you.
Thank you so much, Prof, for being here. I hope you have learned a lot. I hope, I would want you to share this video and also have conversations. For parents, please have conversations with your children. That you are ignorant is not an excuse. It's not bliss. Be educated. Go out of your way and ask questions and make sure that whatever decision you are taking, you are doing it with your full chest. And not this one that we say we do it with our full chest without putting, the consequences, the effects, the long-term effects that some of these things are going to have on us. I hope you would, maybe feel free, just send your questions. Hopefully, I know Prof is a very busy man. To even get him here, like it's like I got an American visa. Having Prof on my set, but we'll find ways to get answers to whatever questions that you have. So I would really love to hear from you. Just check, you will see our social media handles scrolling through. Send your questions. And if you also think that you are maybe at risk, maybe you are being coerced or being pushed to do this and you want to speak up, I will gladly want to help. Maybe find advocates, find people that would fight your cause. Thank you for watching Unspoken. My name is Chichi Omesaka. Until we come your way next time, keep watching. Don't keep quiet. Speak up. Bye.